And we are very excited to get started with this webinar series. Before we jump in, I want to let you all know that we're recording this session, and you've all been muted. Amanda will unmute us all once the question and answer period begins, and I just ask that when we do that, that you mute yourself unless you have a question or you'd like to make a comment, just to keep down the background noise. You can also ask questions through the chat box, which should be on your screen on the lower right side, and that chat box will be monitored through the call. So if you have a question, feel free to just type it in there. So we have some other members of the team on the call today, and people will be introducing themselves as we go along. But I'm going to start us off by talking a little bit about what OpenNotes is, but rather than just listening to me talk about it, we're going to do, in keeping with the 101 theme, we're going to do an OpenNotes pop quiz. So let's start. Question 1, what is OpenNotes? OpenNotes is an electronic medical record. Option B, it's a national movement founded on research. C, it's a software that syncs with your existing EMR. Or D, OpenNotes is strictly a research initiative. The answer is B. OpenNotes is a national movement that is founded on research. We'll talk more about that as the webinar moves along, but we started as a pilot project. Can you advance the slide? So we're a national movement that's dedicated to making healthcare more transparent by encouraging clinicians to make their visit notes easily accessible to patients. So we're not a software or a product. We're not an app vendor. We're not coders. We don't have a server full of notes somewhere. We are simply a philanthropically funded movement encouraging greater transparency in healthcare. Next question, how did OpenNotes start? A, it was one of the few things that Congress could agree on funding. B, it began as a side business for Dr. Del Banco. C, in truth, it hasn't really gotten off the ground yet. Or D, began as a pilot study at Beth Israel Deaconess Medical Center. Yeah, answer is D. It began as a pilot study at Beth Israel Deaconess Medical Center. And next question, what were the results of that pilot study? A, clinician anxieties about opening notes were realized, and there was apocalyptic chaos from which the BI still has not recovered. Option B, patients didn't particularly care if they had access to their notes or not. Option C, 99% of patients wanted the notes to continue, and all clinicians chose to continue sharing their notes. And the answer is D. Virtually all patients wanted to continue to have access to their notes. And even though clinicians were worried about opening the notes, and they were concerned, they were offered the opportunity to shut off their patients' access to notes, and no clinicians chose to do that. So where are we now? We have this pilot study which showed many positive effects for patients and few downsides for patients or clinicians. And on the strength of those findings, we've gone from this small pilot study of 3 institutions, about 100 primary care clinicians, and 20,000 patients, to more than 31 million patients having access to their notes online. At 150 health systems that have implemented note sharing, and we now have an OpenNotes implementer in all 50 states, and the entire VA is open. We've continued to conduct studies about the effects of OpenNotes, looking in particular at mental health notes, the effect of OpenNotes on safety. So it turns out that having patients look at their notes has a safety benefit. How you might implement OpenNotes in a pediatric population where there are particular issues around adolescent notes and confidentiality. And we have some research coming up where we're sitting on about 28,000 patient patient surveys from a survey conducted at our 3 original OpenNotes sites. We've gone back to survey the patients again, and we have some findings around the effect of note reading on medication adherence. A spoiler alert, it turns out it has a positive effect on medication adherence. And on the patient experience, we're looking particularly at patients who reported feeling judged or offended by their notes. And again, small spoiler alert, it's very few patients, but there are some specific things that patients report being offended by when they read them in their notes. Next slide. So what is the future of OpenNotes? Is it A, we have no plans to expand our work? B, we're getting into politics? C, we're buying a Corvette. We're having a midlife crisis, changing our name to Bradley and moving to Napa. Or D, we're piloting a new initiative called Our Notes, which allows visit notes to be co-generated by patients and their doctors. And the answer is D, OpenNotes is piloting a new initiative. In this new initiative, patients are invited to go online before a visit, write the subjective portion of their notes, so essentially what happened to them since the last visit and what brings them in for a visit today, and then asks them to set an agenda for that upcoming visit. And that pilot is just getting off the ground in 4 sites, and we're excited about what we're going to learn by it. So that is a small, a quick overview of what OpenNotes is. I want to move on to Liz Salmi, who is our Senior Strategist for Outcomes and Communication, and she's going to talk about OpenNotes from a patient perspective.
Thanks, Cait. And just want to say I have a cold going on right now, so my voice sounds extra scratchy or extra Punky Brewster if you were an 80s kid like me. It's so great to see all of you folks tuning in to the webinar today. I'm really excited to talk about what we've been up to. So first, I have a question for everybody. And if this is a crowd, I'd say raise your hand, but don't raise your hand. But how many of you, I know we've got a mixed group here. We've got clinicians, healthcare professionals, people working in administration, patient advocates. So out of all of you, how many of you sometimes first turn to the internet when you're looking for information about your health? So depending on where you work, there may be many of you who either first turn to a clinician, but a lot of folks, regular people, are turning to the internet. We know that out of the 40,000 Google searches happening every second, 2,000 of these searches are health related, which is it's really not that surprising, actually. I am not a clinician and I'm not an academic, but I am a patient. And over the last 10 years, I've had this front row seat to the changing nature of information that patients have access to. So much has changed over the last 10 to 12 years about how we communicate both with the world and with each other. And how we communicate information to patients has changed a lot as well. Patients to these days are able to get access to their lab results, surgical reports, but not everyone is getting access to the most important, helpful piece of information, which is our clinical notes. So over the next few minutes, I'm going to share with you a bit about my life as a real patient living with a serious diagnosis and how I've come to now embrace and advocate for transparency and openness in healthcare. And then I'm really excited to shine a light on something new, on how increased access to our medical records is going to be what I think is a game changer in engaging patients in safety of their own care. And so first, you need a little bit of context. And so here's my patient story. So we're going to take you way back to the year 2005. In 2005, at age 25, I got to pick my health plan. And out of all the options presented to me, I chose Kaiser Permanente because for one really important reason, and that's because I like their website. According to the Kaiser website, I could pick a doctor, email that doctor, make appointments online, and order prescription refills. And I could do all of this online. And that was really important to me as a healthy young person because it meant I did not need to talk to anyone. So fast forward to 3 years later, in July 2008, I celebrated my 29th birthday. And then 1 week later, I suffered a massive seizure and I landed in the ER. and scans showed I had a mass in my brain. And then 9 hours later, after a surgery, I learned that I have an astrocytoma, which is a slow-growing but malignant brain tumor with a high rate of recurrence. 6 months later, my tumor grew back, and it sent me into this whirlwind of treatments over the next 2 years, including a second brain surgery, struggles with seizures, relearning how to walk and balance, and then 24 months of chemotherapy. And there's really no right way to respond to a brain tumor, a brain cancer diagnosis, or any cancer diagnosis, or any diagnosis. Really, there's no right way. But my way was to respond with curiosity. And I'm a nerd, and I have a communications background. So my instinctual response was to start blogging about this experience and translating what I was going through to a lay audience of my family and my friends. And, essentially documenting my self-care and decision-making process. But I didn't even know what those words meant back then because I did not have a background in healthcare. And so over the following weeks and then months and now years of blogging, this blog gets an average of about 30,000 visits each year, which still blows my mind. So throughout treatment and then beyond my diagnosis, I began to rely heavily on Kaiser's online patient portal. I really love this thing. After every appointment or test, I would faithfully log into the portal and then stare at these metrics and graphs slide that were depicting various details about what was going on in my body. And after every appointment, I would log in and look at these graphs and was really excited. And if there was a word or a phrase I didn't know, I would just go online and look up that word or phrase to learn what things like, say, platelets meant and what it meant for me. And if I couldn't find online what I was looking for, I would use that same portal to send an email to my doctor and ask a question, because really what use is this kind of information without interpretation? So fast forwarding again to early last year, things have been going well with me. Spoiler alert, as Cait was saying, I am still alive, so things are good. But early last year, something changed for me, and it's actually ultimately what brought me to the OpenNotes team. My husband, Brett, was offered this great new job, and his new job did not give us a chance to stick with Kaiser for our health plan. And this was really nerve-wracking for us. Actually, it's going to happen again for us. Our health insurance plan is changing. We just found out today. And it was scary. We were nervous. But I felt completely confident in my ability to gather my medical records and bring them to a new healthcare team. I thought this was going to be so easy. And little did I know, that this would forever change the way I view having access to my health information. Now, most of you probably know that we have this legal right to request and receive copies of our medical records. But I can tell you from personal experience that takes time and it takes effort, and sometimes costs are involved. And had I asked for a paper copy of my record from Kaiser, it would have cost me 15 cents per page, or in my case, $725.85. But instead, I asked for this record on a digital file, and I was really curious, what did I just spend my money on? And I had stuck one of those digital files, it was on a DVD, into my computer, and I found a 4,839 page PDF file that was my record over the previous 8 years of living with a brain tumor. And my mind was blown, like, what is in there that there are so many pages? So I started scrolling through this record, and some of the things I had seen before, such as emails back and forth with my clinicians, but the majority of it was stuff like this, my notes. So this is a busy slide. I don't expect you all to read it, though I realize some clinicians do like to read it. You're welcome to it. This is a doctor's note, one of my last notes at Kaiser. And my mind was blown when I saw this. So many of you know that our doctor's notes are the most important information in our record. They're there to remind doctors and other members of the healthcare team about a patient's condition and plan for treatment. But like most people, I had never seen this information before. I could Google my condition, but I never knew what my own doctors were writing about me. And again, my mind was blown. Reading the notes was really eye-opening. It helped fill in gaps I missed when I was unconscious or feeling out of it from surgeries or seizures, and really showed that my doctors are listening to me. I mean, there's so much detailed information here, and I really got a lot of value out of it. And looking back, I was like, why couldn't I have seen this in the moment? That was boggling my mind. And really, there isn't a single thing in my notes I don't understand. I was there. And because I have now been blogging this whole time, I'm able to compare my blog posts to my clinical notes. And after every question in my blog, there's this corresponding clarification in my notes. I can't believe it took 8 years to see this information, and I don't want the next person diagnosed with a brain tumor to have to wait 8 years to see this information. Actually, I don't want anyone to have to wait to see their doctor's notes. So I have a rhetorical question for all of you, slide on the call here, and that is, do you find my response to reading my notes surprising? And because I can't hear you, I'm going to say, I don't think you should find it surprising, because I believe, and this is my opinion, that patients like me are being created every day. And I'll break down my thought process there. So in 2006, the internet hit 1 billion users worldwide. Then in 2007, Apple introduced the iPhone, and it quickly became the world's best media player, world's best phone, and best way to get to the web. And then a whole bunch of companies and organizations emerged, or they were transformed around that year. And it really became one of the greatest leaps forward in history, infusing everyone in the world with a new set of capabilities to collaborate and create and gain access to information throughout every aspect of our lives. And if there's this like hockey stick curve, it would be if you're watching me on the webcam here, you'd see my hockey stick curve. But really, people just had access to so much information, for better or worse. And why does this matter? Well, for me, 1 year later, in 2008, I became a patient. So my whole healthcare experience has been colored and shaped by a new culture of easy access to information. And 1 year ago, I decided to join the OpenNotes team because of this. OpenNotes, and Cait had mentioned this, but I want to reiterate it because it's so important, that OpenNotes is a movement founded in research that's encouraging clinicians and other healthcare providers to share the notes they write with the patients that they're caring for. OpenNotes is not technology. OpenNotes is not software. There's nothing to buy here. It's just a philosophy to adopt, and we hope others move forward with it as well. And it's really just about improving patient outcomes through transparency. So I'm going to recap a little bit about the original OpenNotes research. So big takeaways that OpenNotes, we know from research that patients who have access to and read their notes feel more engaged in their or our care. We have a better understanding of our conditions, feel more in control of our health, and are more likely to take medications as prescribed. That's huge. 99% of patients who read notes feel the better or the same about their doctors after reading as few as one note. And care partners benefit from reading notes as much or as more than patients themselves. They really believe that reading notes helps them have more productive discussions about those they're caring for. So that's huge. But what about doctors? So doctors are reporting those who share notes say it has little to no impact on their workflow. So that's really important. They believe that just because they're sharing notes, it's not changing their documentation style. They might make some slight tweaks, but very little changes to documentation. And they believe that sharing notes increases their patient satisfaction. And 0 doctors have reported ordering more tests or referrals as a result of sharing notes. But now I'm going to take this discussion into a new realm that is really interesting to me, and it's around quality and safety. When patients read their notes, a significant proportion of us are able to find mistakes. We find errors in our list of medications, our problem lists, and our medical histories. And all of this has safety implications. This is kind of huge when you think about it. Just think about it. Who better to really to find the error in the chart than the patient? Or as my colleague John Santa says, you know, the patient's 2 eyes on one chart versus the doctor's eyes on 1,000 charts. In 2015, the National Academies of Medicine endorsed the importance of partnering with patients to improve diagnoses, and they specifically urged access to the notes in the EHR so patients can review their notes for accuracy. And these days, we often hear a lot of experts in the healthcare saying, how do we engage patients in safety? How do we really set this in motion? And I say, how might we build systems for patients to review, recognize, and report errors before they lead to diagnostic failures or other problems in care, really? And having patients review their notes could work in tandem from those recommendations from the national academies and really put into practice a tangible, scalable strategy. I think that OpenNotes is a key part of that strategy. And it's that first step toward building strong partnerships between clinicians and patients. And it is all mediated by transparency. So Cait said this before, but today we have over 150 health systems that are sharing notes, clinical notes, in all 50 states. That's about 31 million patients have access to the notes, which is really exciting. It sounds huge, but it's still less than 10% of the US population. So those of you who are tuning in today who are not sharing notes at your health system, we want to talk with you about it and hope that you join us. As I wrap up, I just want to say that transparency, the sharing, I think it's logical and it's ethical. It's logical because we know patients need information in order to be engaged in their care. And it's ethical because information essential to patients must be disclosed and patients must be well informed in order to make decisions. And when it comes to our health, we're forced to make decisions. I've received great care. I love my doctors, but it really makes me wonder even more, why hide the notes? And in my view, I think that sharing should be the rule and not the exception. Our next search of information around our health could really be informed by our healthcare team, and that could be documented by doctors, written and shared in the form of an open note. We all on this call have the power to help ensure patient decisions are well informed, and that patients could be the key player in the safety of their own care. And so, you know, the tools are already here. We're already using them. And let's just put doctors and patients on the same page. Thank you. And I'll hand it over to my colleague, John Santa.
Well, hello, everyone. It's just so terrific to get to follow Liz. So I'm a semi-retired primary care doctor. I actually work from Portland, Oregon, so Liz and I are on the other side of the country from Cait. I'm going to make some comments about how do you get OpenNotes going? How do you do this? And, you know, in the past, we've started, of course, with, well, you got to make sure you got a vendor who can do it, and Epic and Allscripts and Cerner and Meditech can all do it. But we also have folks who have figured out how to make other vendors work, and other vendors are working on it. That's not, I think, the most important thing anymore. This is. It's that you really keep patients and family in mind, that you value dignity and respect, that you want patients and families to participate in their care, that you want this to be a collaborative effort, and that your objective is that complete and unbiased information is shared with patients and their families. This is the right thing to do. Next slide. It's a simple idea. You know, my colleagues, they're wonderful, clinicians are wonderful, but they make things so complex, and this is one that doesn't deserve it. Patients already have the right to read their notes. The issue here is just, do we make it easier? Do we make it more respectful? Do we make it possible for them to do it on their terms rather than ours? Do we enable them to do it efficiently in ways that can improve communication? So it's a simple idea. Don't lose that. Next slide. I'm grateful to Liz for this note. I mean, on the left is a after visit summary. On the right is one of her notes. You've seen a full note earlier. How would anyone who has a significant health issue not want to have easy access to what's on the right? And how would they possibly be satisfied if all they got was what's on the left? This is a big deal. Words matter, and the kind of information that are in notes are wonderful words that they deserve to be able to get at easily. Next slide. I mean, why do they want to read notes? Look at these wonderful reasons why. They want to know. They want to understand. As Liz said, I'm curious. My gosh, isn't it great when you've got a patient who's curious, when they want to be part of the process? They want to know what we're thinking. Isn't that wonderful? I mean, I think most clinicians spend their lives hoping that somebody cares about what they think. And these folks want to know what you're thinking. They also want to remember, I mean, I'm 68. I know how important now it is to remember I need help. Notes, really, they help me as a clinician, and I fortunately have access to my notes. They're really helping me as a patient. Is there an element of they want to check our work? Yep. That's a good thing. You know, some of our research we'll mention in subsequent webinars says, not surprisingly, patients are better at finding out important errors than software is. They're great at figuring out their own issues. Next slide. Your major obstacle is this, a bit tongue-in-cheek. I'm now trying to describe this as a syndrome. Clinician anxiety about transparency syndrome, or CATS. Okay? I mean, this is the big obstacle you need to figure out how to overcome. It may take political capital. It may take time. It may take effort. It may take emotion. It may take stories like Liz's. A lot of providers think that patients will be unhappy with notes and that they'll have more calls, requests to change. There's no evidence of that in any of our research, nor in now these 150 implementations. They're very worried about clinician workload. I can't blame them. They're working really hard. There's no evidence of that happening, though, in terms of, again, either research or our implementation. And in fact, some organizations are beginning to figure out how to use easy access to notes as a time saver. And, of course, we're very intrigued that maybe our notes will allow those folks who want to co-generate notes to really become more efficient. They're worried about the doctor-patient relationship. My patients won't like me. No, when your patients read your notes, they're going to love you. This really increases trust. They can read the notes. They can understand them. They can see how you feel about them. It makes a huge difference. Next slide. This slide I love because of that 99% number. When it comes to a relationship, 99% of patients are going to feel better or the same. And that's especially true for older, non-Caucasian patients with poor health who have a lower formal education levels. Exactly the people that we want to reassure, that we want to get to. Are some patients going to see errors? Yeah. But again, as I just mentioned, that's a positive. That's going to create more trust. Next slide. You are going to need to do some work around documentation. It's simpler than some folks will think, and certainly simpler than many doctors think it's going to be. What are some of the do's? Now, realize some of your patients don't even know what notes are. They don't even know they exist. So you're going to need to spend some time in some cases telling folks what are notes. Use clear recommendations, especially when it comes to planning. Soften some of that jargon. Nobody likes to read they're non-compliant. All they did was tell you that they weren't doing something because they had concerns about it. That non-compliant sounds judgmental. Some don'ts. Don't oversimplify these notes. Keep them as a medical document. Don't avoid sensitive issues. Bring them up, but bring them up carefully. Don't use pejoratives. Don't be judgmental. Work on getting rid of acronyms, some of which can embarrass you, or other abbreviations. We know, again, from these implementations that these kinds of changes can be integrated easily by physicians, and within weeks or a month, really the quality of their notes is improved, and the time it takes to do these sorts of things is no longer significant. Next slide. What happens is, I think, we begin to go back to maybe the way it used to be. Notes aren't administrative work. In fact, they're a special part of the clinician-patient relationship. They're part of this new world of connected care, of communicating with patients when they're ready, on their terms, not when we're ready, on our terms, only face-to-face. That they're easily available, that they're convenient. In fact, we see when organizations go from an implementation that includes mobile phones, wow, a big increase in participation. You come to a situation where patients are truly like us clinicians. They forget half of what's happened the day before, but they have a note to go back to help them remember it. There's more equality in the partnership. Next slide. Now, we're also finding out, though, that just flipping the switches, making a few announcements to clinicians, maybe putting something in a newsletter, may not accomplish much. In fact, the predominant feedback we're getting from sites who are implementing OpenNotes is they're surprised that their read rates are low. In fact, oftentimes single-digit percents, oftentimes less than 5%. So we're now working a lot on how to get to effective implementations. And a future webinar will focus specifically on that. But, the principles are you got to tell people and tell them again, both clinicians and patients, that their notes are there. You got to remind them. Navigation's a big issue. Navigation's a huge issue. Patients aren't finding their notes, more so in some systems or some versions than in others, but we're figuring that out. Part of this gets at how do you measure effective, and that's an issue we're working actively on and will address in the future. Next slide. In conclusion, medicine and technology are changing, and it's a great thing that they're changing, that OpenNotes helps to improve care. The clinical concerns are common, but they're overstated. We're over-anxious about what transparency can do. I mean, I've been doing this for 3 years, 150 organizations we've talked to after they've implemented, and every single one, implementation always ends well. Effective implementation, though, we're going to need to work on. Next slide. So we're very interested in connecting with you. And part of that is a chance to discuss in this environment today what questions you have, what concerns you have, and we'd love to know any information or questions or comments that you have. I'll turn it over to my colleagues. Thanks, everybody.
Is there an option for people to raise their hands or to just ask questions through the chat box?
Yes.
Thank you. Okay, so any questions? Feel free to raise your hand. All right. Well, I'm going to ask John a question. So, John, you spend a lot of time talking to healthcare organizations, and can you talk a little bit about what do you hear from hospital leadership about reasons why they may or may not implement OpenNotes? What are some of the most common things that you hear?
What Cait just asked, far and away, the issue that leadership has is they turn to the chief medical officer and say, can you get this done? Will our clinicians do that? Essentially, we're at that clinicians anxious about transparency syndrome. And a lot of this depends on what the state of the clinician culture is. Folks who are in the midst of the burnout epidemic have a hard time doing OpenNotes. Folks who are figuring that out, who have had an easier time in terms of technology, are more likely to take OpenNotes on. In some cases, leadership themselves are dedicated to transparency, and they will put this high on the list. In those cases, they're willing to socialize this process. I was just in Utah at wonderful Intermountain Health. Intermountain realized that they wanted to make this commitment. They wanted everybody to be involved. They wanted as many notes as possible to be shared. They spent 18 months socializing this with their physicians. I was at the first meeting. There must have been 150 physician leaders in the room, and the new chief executive officer stood up and said, we're going to do this. We're going to take whatever time we need to surface all the issues. We're going to do this. We're going to do it right. We're going to do it well. They've been doing it for the last year. Yesterday, they presented data on hundreds of thousands of page views related to notes. So it's getting at the culture issue is the single biggest thing to do.
We have a question in the chat box about OpenNotes in mental health and pediatrics. And a follow-up is specifically about laws that forbid allowing the display of behavioral health notes.
Mm-hmm. So John can feel free to also jump in on this answer, and I think the main response is that the laws vary widely by state. So I'm more familiar with laws around adolescent confidential information, where some states allow there's different ages when a kid becomes an adolescent, where parents are not allowed to, or only allowed proxy access, or they're allowed to see certain parts of the notes and not others. So those laws are highly variable, and I expect that that's the same around behavioral health. But what I will say about behavioral health, and John, I'm going to paraphrase you here, is that one of the things that we've noticed is that organizations will decide to carve out the mental health notes. So they'll decide to open notes in ambulatory care except for the mental health notes. And our feeling is what's happening there is we're creating a parity issue around access to information. And hiding the behavioral health notes or the mental health notes can also simply just reinforce stigma around mental health issues. So essentially the message is there's something so disturbing in those notes that even the patient shouldn't be reading them. Now, I will add just a caveat there to say that all of the major EHR vendors that we work with allow clinicians the option to hide a note. So if there is a reason related to safety, one of the examples we hear all the time is domestic violence issues noted in the chart. Those kinds of notes can be hidden if there's a good reason to. And John, I don't know if there's other points you want to make there.
Yeah, I think just some data. I'm sad and worried to say that less than half of the implementers that we have included mental health clinicians. The mental health clinicians are the folks who are really anxious. Data from the VA suggests they're even more anxious than the physical health clinician. But there's no evidence from our research or the probably 50, 60 implementations of mental health that have occurred that increased anxiety is justified. All of the mental health implementations have gone well. And I think we're very concerned that we're seeing a parity gap build around technology that we know the mental health community as a whole and mental health patients are going to be very concerned about. So I think this is an issue that has to be addressed. I have heard concerns come up about state laws, including in my own state in Oregon. Well, that has not stopped the VA from sharing mental health notes. It has not stopped Kaiser Northwest, which has been all along one of the model implementers of OpenNotes, from sharing notes in terms of their mental health clinicians. So I would be very surprised if a state law ends up actually prohibiting the release of information to mental health patients themselves. So we've got some work to do there, and hopefully we'll be able to succeed better at it than we have up to this point.
Thanks. There's another question about whether or not OpenNotes has been used with any non-clinical providers of home and community-based services.
This is John. I suspect it may be being used out there, but since our focus is on ambulatory notes, we don't keep track of that. I've certainly run into home health folks and long-term care folks who are interested in sharing notes. I just saw a report the other day about inpatient notes, and again, while we don't focus on inpatient notes, I think there are now 50-some organizations that released some sort of inpatient note, not always progress notes. They may release the admit H&T or the discharge summary. So that's happening, but again, we're not tracking that as closely.
There is also another question about, with the current versions of the major EHRs, how much time or energy does it take for a health organization to turn on progress notes so that patients can view? And there's also a question about cost, which is related, so maybe those two can be addressed together.
Yeah, this is John. Why don't I take a shot at that, and some of my colleagues may have comments. For Epic, Cerner, Allscripts, and Meditech, this is an easy process that really is the equivalent of moving switches on and off. I'm told in some places it's literally a few hours to a very manageable time, and I'm not aware that any of those vendors are charging anything additional to support OpenNotes. In some cases, there is some internal development that'll be needed, but it's manageable. Again, on the calls I've been on with systems who are implementing, the issues are not technical, at least for those vendors. If these wonderful folks who can figure out how to essentially hack into their systems and do it, yep, I suppose it takes more time than that. Where the cost comes is in political capital and in time spent socializing the clinicians to give this a try and to listen to the research and implementation results that we had.
Thanks. That's awesome. So there are a couple of questions around how do we have presentations from clinicians about opening notes and their experience of that, and about project owners or health systems who talk about implementation, their experience of implementation.
Well, this is John. Almost always, again, given that we have 150 implementers, we can usually match folks up with organizations in their same state or region with their same vendor. So we can oftentimes match folks up with someone they see as a comparator to hear from them about a successful implementation. Oftentimes, and it's totally unpredictable, a specialty in one place will just refuse to go forward with the implementation. We can always find a specialist from somewhere else that's actually a champion. Other than mental health and adolescence, we have no evidence that any specialty should consider themselves to somehow be the exception, and that transparency doesn't work for them. We've talked about mental health. We really don't think they should be an exception either, but they do require more convincing. Adolescent physicians are the one set of folks that is tricky, and there are state laws that make adolescent information tricky to pass on. And so that we do see appropriate variation in sharing of notes depending on the culture, the state, et cetera.
On the topic of clinicians talking about their experience sharing notes and folks to be able to learn from other health systems and not just from us OpenNoters, I did want to mention we have a couple OpenNotes consortiums that are geographically based where different health systems are learning from one another. So I co-chair the California OpenNotes Consortium. If any of you are on this webinar and you're in my state, send me an email. I'll throw it into the chat box. But essentially, you can join our quarterly calls, and we have presenters from around California talking about how they're doing with their OpenNotes implementations. We also have a Northwest Consortium of Oregon and Washington. We've got a group in Wisconsin. We've got a group in New York State. But even if one of those geographic consortiums doesn't fit your area, you're welcome to join us or talk about starting one yourself. And then I did want to point out an interesting thing in the chat box. Cait, I think you might address this. It may be someone who's confused, but the question is, has OpenNotes experimented with FHIR, F-H-I-R? And
yeah.
Cait, I want you to address that one if you could.
Sure. So Smart on FHIR, the new programming specs, which run most of the internet, including the websites we use like Uber, Amazon. That's not what healthcare uses quite yet. We're still in healthcare using the old version, but there is a move to update programming specs to be Smart on FHIR. And because we are not a vendor and we're not an app developer, we ourselves are not specifically experimenting with FHIR, but we are keenly following the progress of groups like Project Argonaut, which has included clinical notes in their specifications project that they're working on this year. So we expect those specifications will be out. We expect that third-party app developers and Apple will start to include notes in the things that they code for in their apps. As I'm sure everyone on the call is aware, Apple has a function that's native to the iPhone, which allows you to download your notes. I'm sorry, I misspoke. It allows you to download your record to your phone. And when the Smart on FHIR specs are available, we fully expect that Apple will be including notes native to the iPhone. So we are following what's happening, but we ourselves are not in the app development world. So we're not actually we're not doing it ourselves, but we are trying to exert our influence to ensure that the notes work is completed, and that it's completed in a way that keeps patients' needs and what patients want in mind as they go forward.
Awesome. So we have two more questions. One is related to mental health, and the other seems related to our notes. The first question, I'll just throw them together so and you all can field them. How can you allow patients with those with difficult mental health diagnoses to contribute to notes, as in our notes, since those patients are at high risk of false or inaccurate information? For example, this provider had a patient demand to add his medications to add Dilaudid to his medications list. The other question that seems related to our notes as well is how many health systems encourage patients to submit a history or issues pre-visit in a semi-structured patient portal format as an introduction to an upcoming visit? And have there been any studies of health system time savings from this tactic?
So I can take that question, and I'll start with the first with question one, which was about allowing how do you allow patients, particularly patients with mental health issues to contribute to their notes. And the way that I think about it is that OpenNotes is like a new medicine or a new procedure. It's not going to be good for every patient. It will be good for a lot of patients, but like anything in medicine, it doesn't fit for every patient. So that is always up to the discretion of the individual provider. So I'll say that first. Then the second piece around studies, so as far as we know, this experiment that we're trying with asking patients in advance to co-author a portion of the note is pretty novel. We know of some places that are doing sort of similar things. Harborview Hospital out in Seattle ran a pilot where they gave patients iPads and asked them to do something similar. There's work going on up at Dartmouth with cystic fibrosis patients where they're asked to set agendas for visits in advance. Because this is so new, there is not a lot of data around cost. We expect, based on the reaction that we get from lots of clinicians when we talk about this, that many of them expect this will be a time saver for them, but it's still too early to tell.
Thanks, Cait. Last two questions that I see. One, several people are asking about a recording. Yes, we will be sending out a recording of this to everyone on the list. And the other is whether or not you will get a free OpenNotes T-shirt for participating.
We're going to have to make that happen. I think
Sadly, currently we do not have T-shirts, but your recommendation is noted.
Yeah. I think if you take on, go ahead. Well, I was just going to say, if you take on championing OpenNotes in your health system and you contact us so you become like the lead liaison, we will make sure you get a T-shirt. I will pay for T-shirts if that needs to happen.
Yeah, this is John. I think we could get some T-shirts that say the Los Angeles Dodgers World Champions 2018 very cheaply. So we'll look into that. But we prefer to send you an OpenNotes T-shirt or a Red Sox T-shirt.
Oh my goodness. Oh my goodness. There was somebody who chimed in, Mike Redman, who wanted everyone to know that they went up on ambulatory OpenNotes at Gunderson Health System for adults in January 2018 without any issues whatsoever. So now we have a ringing endorsement. Thanks, Mike Redman.
Okay. If there are no final questions, I'll just take this opportunity to say thank you for joining us today. Here's our contact information. Feel free to contact us at any time. You can also go to opennotes.org, where there are links to our communications director and our other staff. So please pepper us with questions. We're happy to help, and we will be thinking about that T-shirt idea. Thank you.